This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: what is Ehlers-Danlos syndrome? Answer: Ehlers-Danlos syndrome is a condition caused by faulty collagen synthesis, resulting in hyperextensible skin, hypermobile joints, and a tendency to bleed easily. Question: how many types of Ehlers-Danlos syndrome are there? Answer: there are multiple types of Ehlers-Danlos syndrome. Question: how is Ehlers-Danlos syndrome inherited? Answer: the inheritance and severity of Ehlers-Danlos syndrome can vary. It can be autosomal dominant or recessive. Question: what are some associated complications of Ehlers-Danlos syndrome? Answer: Ehlers-Danlos syndrome may be associated with joint dislocation, berry and aortic aneurysms, and organ rupture. Question: what is the most common type of Ehlers-Danlos syndrome? Answer: the most common type of Ehlers-Danlos syndrome is the hypermobility type, which is characterized by joint instability. Question: what is the classical type of Ehlers-Danlos syndrome? Answer: the classical type of Ehlers-Danlos syndrome is characterized by joint and skin symptoms and is caused by a mutation in type V collagen, such as COL5A1 or COL5A2. Question: what is the vascular type of Ehlers-Danlos syndrome? Answer: the vascular type of Ehlers-Danlos syndrome is characterized by fragile tissues including vessels, muscles, and organs that are prone to rupture, such as the aorta and gravid uterus, and is caused by mutations in type 3 procollagen, such as COL3A1. Question: what are the symptoms of Ehlers-Danlos syndrome? Answer: symptoms of Ehlers-Danlos syndrome include hyperextensible skin, hypermobile joints, and tendency to bleed easily. Other symptoms may vary depending on the type of Ehlers-Danlos syndrome. Question: how is Ehlers-Danlos syndrome diagnosed? Answer: Ehlers-Danlos syndrome is typically diagnosed through a combination of a physical examination, a patient's medical history, and genetic testing. Question: is there a cure for Ehlers-Danlos syndrome? Answer: currently, there is no cure for Ehlers-Danlos syndrome. Treatment focuses on managing symptoms and preventing complications. Question: can Ehlers-Danlos syndrome be prevented? Answer: Ehlers-Danlos syndrome is an inherited disorder, so it cannot be prevented. However, early diagnosis and management can help prevent complications. Question: what are the long-term implications of Ehlers-Danlos syndrome? Answer: the long-term implications of Ehlers-Danlos syndrome can vary depending on the type of Ehlers-Danlos syndrome and the severity of symptoms. It can lead to chronic pain, joint and skin problems, and in severe cases, organ rupture and other serious complications. Question: is there any special diet or exercise program for people with Ehlers-Danlos syndrome? Answer: there is no specific diet or exercise program for people with Ehlers-Danlos syndrome. However, it is important for people with the condition to avoid activities that put excessive stress on their joints and work with a physical therapist or other healthcare professional to develop a safe exercise plan. Question: can medication be used to treat Ehlers-Danlos syndrome? Answer: medication can be used to manage some of the symptoms of Ehlers-Danlos syndrome, such as pain and joint instability. However, there is currently no medication that can cure or fully treat the condition. Question: how does Ehlers-Danlos syndrome affect the skin? Answer: Ehlers-Danlos syndrome can cause the skin to be thin, fragile, and easily bruised. The skin may also be hyperextensible, meaning that it stretches more than normal. Question: what is the life expectancy of someone with Ehlers-Danlos syndrome? Answer: the life expectancy of someone with Ehlers-Danlos syndrome can vary depending on the type of the disorder and the severity of symptoms. In general, people with Ehlers-Danlos syndrome have a normal life expectancy, but they may be at an increased risk of certain complications such as organ rupture. Question: is there a support group for people with Ehlers-Danlos syndrome? Answer: yes, there are support groups for people with Ehlers-Danlos syndrome and their families. These groups provide a forum for discussing the condition, sharing information, and providing emotional support. Question: how common is Ehlers-Danlos syndrome? Answer: the exact prevalence of Ehlers-Danlos syndrome is not known, but it is thought to be relatively rare, affecting 1 in 5,000 to 1 in 20,000 people. Question: what are the most common types of Ehlers-Danlos syndrome? Answer: the most common types of Ehlers-Danlos syndrome are the hypermobility type and the classical type.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.